You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Here's the videos that folks put together. Again, just so you understand the response of Trump from one point to the other. Then you get the folks at Fox News, which is a whole different world. Y'all go ahead and play this video. Play this video showing you, again, the disparity in the responses.
This is yet another attempt to impeach the president. And sadly, it seems they care very little for any of the destruction they are leaving in their wake. We must test for the virus in order to stop the spread of it. What could be a very great recession. Some predicting even a depression.
At worst case scenario, it could be the flu.
I feel like the more I learn about this, the less there is to worry about.
I was about to say the same thing. We don't have immunity to this virus. It's a new virus. It's a pandemic strain of a virus we haven't seen before.
All the talk about coronavirus being so much more deadly doesn't reflect reality. Without a vaccine, the flu would be far more deadly. We are facing an incredibly contagious and dangerous virus that is moving across the world from one hotspot to another.
We're going to call out anyone and everyone who's using this virus as a political weapon against the president. The standard flu every single year kills tens of thousands of Americans. We are now entering what will be the crucial defining 15-day period as it relates to this virus, where we must slow the spread of coronavirus.
It's actually the safest time to fly. Everyone I know that's flying right now, terminals are pretty much dead. We have a responsibility to slow down this virus and to think of other people during this time. And so if you can keep your distance and prevent someone from getting close to you that might be sick, you could save your family, you can save the elderly, and help our country as a nation.
It is absolutely disgusting that Democrats are seeking to use this complex virus to score cheap political points. This dangerous health crisis could dovetail quickly into a political crisis, already feeling economic ramifications of it all.
Here's what I think would happen. I think Suzanne Scott, the CEO of Fox News, had a meeting and say, dumbasses, our audience, they're the ones who are most vulnerable. Take this seriously. That's what I think what you're seeing. All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Nope. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, you know, it gives you that flower effect like that. But if I wanted to also, unlike other, because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, it goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? youtube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's youtube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. Economist, formerly head the economics department at Howard University. Bill, this is the problem that I have here with this whole deal. The coronavirus, the whole focus has been driven largely by stock market. It hasn't really been a health issue. Now, all of a sudden, we're seeing the economic ramifications, stock market going down. We wiped out all of the stock market gains since Trump has been president. We're now at the levels when Obama left the White House. We're now seeing unemployment numbers, claims blowing up all across the country. They're talking about a $1 trillion infusion. There are others who are saying, no, this thing is so significant. You're going to have to literally, it could be as high as 5, 10, 15, 20, $30 trillion in terms of sending money directly to the United States, directly to U.S. citizens. I mean, that's the type of situation that we are in, because at the core of this bill, we still don't know how big of a problem this is, because we have not had massive widespread testing.
Well, we didn't have the testing, so one of the problems is even the steps that have been taken, we don't have a way to evaluate how well they're performing because of that. But this is also an economic issue, and it's an economic issue and a health issue, because this is a downturn that's centered around service sector workers. We're shutting down the restaurant and drink establishments. There are 12 million Americans who are employed in food and drinking establishments. That's the size of our manufacturing workforce. So what we've just done is pretty much equivalent to telling every factory in the United States close when you think about how many people are involved. But these are low-wage workers. Most of them do not have paid leave. Many of them have no leave at all. They don't get to take sick days. Many of them have earnings that are too low to meet the earnings test to get unemployment from their state. Many of the states have put up very poor systems for people to access unemployment. So we're talking about a real catastrophe from a health and economic perspective when you look at the frontline workers who are being affected, and think about the frontline health workers that you are hearing are catching the disease because the hospitals and the administrators fought against implementing OSHA regulations that would ensure that workers would have the proper protection. So we're going into this in Washington, D.C. Just recently. We had an EMS station where one worker tested positive, and now the rest are under quarantine.
Well, and again, that's where we're struggling in such a huge way, because what people don't understand, when you talk about this whole issue, what people don't have with those resources, when you listen to the Surgeon General say, call your doctor, what in the hell do you do with the people who don't have doctors? The number of low-income people who, frankly, rely on emergency rooms. Then you have an administration that hated the Affordable Care Act, did everything they could do to knock it down. Then you had Republican states, those governors and legislatures, who didn't want to have Medicaid expansion. And so now what we're seeing right now, we're actually seeing our system being stripped butt naked and exposed for what it is. In a moment, I'm going to talk to Principal Steve Perry and what's happening on the education, because all the people who are saying, shut the schools down, homeschool them, or you can go online. But then you got, South Carolina, they're actually converting 3,000 school buses into mobile Wi-Fi units, because guess what? the kids don't have internet. And so you got all these people who are walking around, and I keep telling people, stop assuming because, you're middle class and you've got Wi-Fi in your home and you've got cable and you're able to go to Costco because you got a Costco card. Well, guess what? You got to pay for a damn Costco card. There's a bunch of families who can't even pay for a Costco or a Sam's card, and these people are wondering like, oh, I don't understand what's going on. And so now you have, Bill, calls from people like Mark Cuban. I saw Ali Velsh's show who was saying this is now, when you have a calamity, now you deal with your structural issues of inequality. And so from your vantage point, how do we do that? Because if you're now talking about dropping $1 and $2 and $5 trillion directly to Americans, how do we now confront what has been a fundamental problem in this country for decades?
Well, this is one of the big problems. The Senate just finally, this is Wednesday, they finally signed off on the House bill passed last week to make sure that we would have paid sick days. And this is common sense. The people who are serving you food, they're serving you food, and you don't want them to have a paid sick day. You'd rather have them come to work sick than have them stay home. This is the lunacy, but the Senate and the White House fought against paid sick days for all workers. They limited it so that it's only workers if your establishment has more than 50 workers or fewer than 500. So you left out somewhere between 6 and 19 million Americans who are working and still will not have paid sick leave.
But here's the thing, it's crazy, Bill. Okay, so you take, look, I have a small-owned business. That's what this is. I have 12 employees. So the problem is what you just described, we don't qualify for. And if you look at black-owned businesses, there are 2.6 million black-owned businesses in America. 2.5 million only have one employee. And then look at those 100,000 that have more than one employee. Most of them don't have, frankly, more than 10 employees. So when you start talking about how this impacts different sectors, these are people making decisions and you're not dealing with true small businesses in America.
Well, they aren't, except they write out exceptions. Their way of dealing with it is to say, well, we'll exclude you so you won't have to deal with that. But here's the reality. For those small businesses, if you're a restaurant owner and you don't retain your workers and they get let go, when we finally get a hold of the disease, maybe 9 months from now, everything we hope will be back to normal if we're doing the right steps now. Where are you going to find your workers? You let them go. The number one thing is to provide paid sick leave to paid leave for these workers so that they stay attached to their employer so that when things resume, the employer isn't going around saying, now I got to recruit a whole new workforce in order to get myself up and running. Right. This is for the business's protection as much as it is for the workers' protection.
Is this also time, Bill? Is this also time to also deal with the fact that you have a lot of these major companies? Again, I'm going to pull an Ali Velshi tweet up in a second where he said, where you have a lot of these CEOs who are making 220 times what an average worker is earning. And now all of a sudden, everybody, Bill, is lining up for a bailout. Airline industry. Boeing wants a $60 billion bailout when, in fact, Boeing's problem really had to do with the 737 MAX. And so we know what that game is. Now, hotel industry. I was seeing a story where the hotel union said some 700,000 people who work for hotels could be out of jobs. Marriott instituting massive layoffs. We can go down the line. You got Sheldon Adelson, these casinos who want to bail out. I'm sorry, Sheldon Adelson, you're worth $31 billion damn dollars. Bail your own ass out.
Well, this is the thing. In fairness, it's okay for them to get the bailout as long as, and number one, as long as it's to make sure that the employees stay employed, as long as the workers are getting a paycheck. This is the key issue. So in the airline case in 2001, because of 9/11 and the disruption to air traffic, we bailed out the airlines. What did they do? Many of them immediately went into bankruptcy, got rid of their union contracts, got rid of retirement, workers got nothing. They didn't look out for the workers of the airline industry. And so the airlines are back again, and now they're asking for another bailout, no strings attached.
No, I'm sorry. I'm sorry. No, this is where you have to have members of Congress with integrity who say this bill is not going to go forward unless you're protecting workers. If you're Nancy Pelosi, if you're Steny Hoyer, if you're Jim Clyburn, if you're any of them, I don't expect the Republicans to do any of this, but somebody has to say, no. We are not nope, not going to happen again. We're not going to bail these folks out who, again, are screwing the American people. And what they want to do is tide themselves over and, bank that money. I'm sorry, that dog ain't going to hunt.
Well, it shouldn't. And as you mentioned, retailers now want a bailout and fairness. Again, in the public interest, we've asked them, please don't open up. Please don't do that. Walmart is the biggest employer in the United States, well over 500 employees. They're the number one group in front of Congress saying, make sure that the paid sick days do not apply to us. These are billionaires, the richest people on the planet, the Walton family. And they're saying, no, we don't want legislation that gives paid sick leave to everybody. And in fact, they accused Congress and the labor unions, oh, you're just using this emergency to get the paid sick days that you've always been arguing for. But we've been arguing for them because we went through H1N1 flu in 2009. We thought we learned our lesson. We didn't. So here we are again at the last minute trying to hobble together common sense policy approaches.
Bill Spriggs, we'll be talking to you a lot more over the next several weeks as we sort of sort this thing out, what is happening economically all across this country. Again, the actions Congress take will go a long way to fixing the system, and so we'll see what happens. Thanks a lot.
Thank you. Let's hope that they do focus on workers, because the people who are being hurt are the low-wage workers that normally get ignored by everybody whenever there's economic pressure.
You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. All right, folks, very few African Americans serving in the military have ever had 4 stars on their shoulders. My next guest, he is one of them. He was the first leader of AFRICOM, that command when it was started under President George H.W. Bush. General Kip Ward joins us right now. General, glad to have you here. You heard the Secretary of Defense there. General, look, you've had to deal with these issues, being over AFRICOM, dealing with the issues with Ebola and other issues happening all across the globe. Explain to the audience, really being in the room, how the military operates when something like this here. This is a national security issue as well. You know, how do you mobilize? We heard that in the military, look, that they've canceled all domestic international flight, allowing people to stay where they are. So give us a sense of how the military is operating and thinking right now.
Good evening, Roland, and thanks for inviting me to participate this evening. A couple of dimensions that we want to consider here. First of all, the military, as the Department of Defense and all of its entities, has this primary mission, obviously, of safeguarding our nation's security, both at home and abroad, in varying ways. As a brigade commander, for instance, I deployed my brigade to Florida for Operation Hurricane Andrew relief because our citizens at home needed the support that we, the military, could provide. The second, and I'll go back into more of that in a bit, and the second dimension is that as a citizen, we too are subjected to the same sorts of things that every American citizen is subjected to, be it at home or abroad. And so doing the things that are prudent measures that every citizen would do, that is also a part of this dynamic. So when you look at the specifics of the reaction, the activity being undertaken by the military, candidly at this point, my understanding is that you have as well. I'm not deeply involved in this at this time, but understanding the processes from the standpoint of what you do to protect the force. And those are the things that are common things that are being done by every American citizen that candidly are our first line of defense when it comes to protecting ourselves from COVID-19, this spread of this virus. And then secondly, the things that can be done by the military as an institution of our federal government that will support the efforts of our other agencies, local, state governments, with respect to being able to respond, address contingencies as they arise. And in this particular situation, we're learning things every day, and then being able to present these sorts of contingencies, alternatives to the decision maker such that those resources can be brought to bear if needed, where needed, and in a timely way.
When we hear people say the military should be dispatched, National Guard should be dispatched, if that's the case, how are they used? Used to do what?
The dispatch of the National Guard, obviously, in our system, those forces belong to state governors. And as you've indicated, and I've heard, many of the state governors are in fact dispatching and using those National Guard forces to do a multitude of things. It could be assisting the state and local authorities to do things such as distribution of food, other material that help to abate the crisis. They could be used to help transport, provide logistics. It's basically in logistics support, and in some cases, potentially to provide a security umbrella for the conduct of other activities under the direction of the state and local officials when it comes to the National Guard. And at this point in time, it is the National Guard who is under the jurisdiction of the governors and the territorial entities to provide that type of support. And it's wholly appropriate that governors take their National Guard outfits and provide that type of logistical support in order to support the activities of their state and local entities.
We heard them talking about the Defense Production Act and then what that does to free up. Can you explain again for the audience who doesn't know anything about the Defense Production Act, what that even does?
Essentially, in a national emergency, those industry activities that produce commodities that are important in addressing a particular situation can be directed by the president to then develop as well as to produce those items of equipment that are important to addressing the national scenario. And so in this case, those private entities that make various things that are important in addressing this situation, because of the invocation of the Defense Production Act, those institutions and those jobs, those particular agencies, those corporations devote their resources to producing products that particularly designed to address this situation. And that is done under the auspices of the Defense Production Act.
Hey, General Ward, this is A. Scott Bolden. Good seeing you again. I hope you're doing well. My question has to do with what we're not seeing. In your opinion, what aren't we doing? What aren't we seeing? What aren't we moving forward as the federal government addresses this coronavirus? For example, I raised earlier in the show the Army Corps of Engineers could be brought in to lead to set up hospitals. They build bridges. They do all kinds of incredible things all over the world, and yet we don't see them in some leadership role. We don't see FEMA in some leadership role. I know you've got some experience with working with FEMA. And so what aren't we doing, and why aren't those agencies leading, or why aren't we hearing about them?
Yeah. Hi. Hello there, Scott. And two things that we need to understand about that process. One, in our federal system of government, and regardless of how we may think about it, and having been a part of many forms of government, this one is the one that I would certainly want to be living under, where when you get to the type of disaster situation that exists, and this is clearly a global disaster situation and is impacting our country, but the state, local authorities put the demand on the table. You don't see generals like I was marching into an area and saying, this is what I'm going to do, move aside. Now, there may be times when someone might want to see that, but again, that happens in places where I've been, and certainly you have as well, and that's not how our system of government is established. And so unless a lot of other things change, that piece of it is the way it is, and candidly, I'm okay with that. Secondly, when it comes to what's not being seen, I mentioned the fact of contingencies. You know, the United States military, we plan for the unknown, not because we know the specifics, but when it comes to providing support, a range of contingency actions that can be taken, from moving logistics and supplies to safeguarding facilities to providing stocks that may exist in the stocks of the Department of Defense that could be then used in that civilian contingency, from airlift to other sorts of things, are appropriate. The response is contingent upon the examination of the specific activity at the time, as opposed to doing things, and to use a term that I use when I served AFRICOM, you want to add value and at a minimum do no harm. And so as you add value, that value must be from an informed position. And that information is derived from how you understand what you're getting from state and local entities. And then once that's understood, you respond in kind as best as possible when it comes to moving forward and supplying with either logistics, augmentation of personnel, some organizational activities. And so the various entities, be it the U.S. Army Corps of Engineers, which is basically a civilian entity. It's basically a civilian entity that comes together. It doesn't exist in one glob. It comes together as pieces may be needed from the contractor support that's available. You have certainly a professional corps that's there that operates day in and day out. But when it comes to standing up and bringing things together, be it out of our National Guard and Reserve, mobilizing these activities is what goes on. The plans that exist to do that are plans that are contingency plans based on a range of scenarios that can be tailored to the specific situation at hand.
General Ward, it's Lauren Burke. How are you? During your time in the Army, there's a lot of rumors right now about quarantining people. I don't know whether they're true or not. It might be the Russians playing around with us. But when you were in the Army, you ever hear of a plan that sounded like it could actually happen, where Americans would be quarantined someplace for any reason, whether it was disease or anything else?
Well, certainly quarantine is a term that we all are aware of. There is, from the standpoint of my specific understanding, a quarantine for the sake of quarantine isn't something that was done. You have a circumstance or a situation where to safeguard, to prevent, that certainly is there. But no, I've not been apprised of any specific situation whereby you quarantine for the sake of quarantine, other than some existential situation that exists that makes quarantine a very valid course of action to be taken, as would be potentially the case here. And as right now, in a sense, we are there. I mean, I'm here now, I will, quote unquote, grounded, because I'm taking the advice of those who would say it's best to stay put and prevent the spread of this thing. And when you see folks who don't do that voluntarily, well, it's kind of like what President Kennedy said many, many years ago, ask what you can do for your country. What every individual American citizen can do to help combat this is to interact as little as possible, because the more you interact, the greater potential is for this thing to spread in ways that we still don't understand candidly. And the greatest prevention to that is to stay put so that you don't risk the spread of this disease. And in today's global environment, it's even more a potential if the mixing, the interaction is such that it just enhances the potential for that happening. And so quarantine, if the situation demands it and requires it for many reasons, would be an appropriate course of action, given all other options and alternatives having been tried, tested, or deemed to be would not work.
Hi, General Gene Craig here. Question. So we have an absence of leadership right now. And so my question to you is, being someone that oversaw AFRICOM and, has a thorough understanding of, what disaster response looks like on multiple different levels and different scales, if you were president, who would be the one person that you would, appoint essentially as the point person to handle this response, to bring all the levers of government together, local, state, federal, and how would you empower them? Because I think that's what we need right now. I mean, a lot of the governors are stepping up, but the federal response just isn't clicking right now.
Yeah, well, I don't think I could answer that because I probably don't have all the information that would be important to make that determination. Again, we live in a federal system of government, and that federal system of government that I swore for 40 years to obey and respect, and I still do. Nothing has changed about that. And unless we're to throw a lot of other things, then we have to ensure that what we do in our federal system of government works. And in these cases, and it is truly a national scenario, but our state, local authorities that are backdropped and supported by our federal response capabilities and resources are where we ought to be, and collaborating and cooperating and discussing so that things are known, facts are known as best as we can, because there's no 100% guarantee of any day. These things are changing daily. And one of the, I guess I'll call it one of our axioms that we use in the military, no plan survives once you cross the line of departure. So what we were thinking last week is different than what's happening today and will be different than what goes on tomorrow. And so to be wedded to a particular thing because it was what it was a week ago is candidly reduces your ability to respond. You respond to the scenario as it changes, doing your very best to be out in front of it and doing those proactive things as best as you can determine will support where you are and where you want to go. And so for me, who that person might be, again, not in a position to say. The involvement of the team is important, and listening to what the team brings to the table from the varying perspectives to make a decision is where we are, and I'd probably be on the same side of moving forward.
General, I do have to ask you this here. Speed matters. Look, you served in the military. You know what happens when people wait. You know what happens on the battlefield when folks say, well, no, let's do this 48 hours from now as opposed to do it now. It sort of sometimes it works both ways. You got to have enough time to get your troops prepared, have your logistics in place, your supply lines to be able to execute something. But when you look at something along those like this here, when you look at a video, and guys, go ahead and play that video again. This was February 12th of this year. And there was a coronavirus hearing in the Department of Homeland Security. And Senator Kamala Harris put this video on her Twitter feed on February 12th, 2020. I want you to listen to this, and we'll talk about today being almost a month later. Guys, go ahead and play that.
The American people also, Mr. Chairman, need to hear from the officials who are currently responsible for addressing this. And we need a public hearing with current government officials as soon as possible. It is critical to my state of California. I have spoken with some of the current officials and asked them why they are not here today, and they did not have they did not have a good response for why they are not. In fact, they went on to say, well, we have to take time to prepare talking points. The American people deserve them to be here this morning.
I'm not asking you to critique this administration. If you choose to do so, you will. But when you think back to that, February 12th, 2020, when you look at the comments where Trump was like, we got to contain, it's under control, I'm not really worried about it. Here we are a little more than a month later. We still aren't even testing, 1,000 people a day. There are things that are happening more than a month later that should have been really in place a month ago. Can you speak to, when time is of the essence, how every day delayed makes this situation even worse?
Yeah, Roland, and I appreciate that. The essentials of time are clearly important with respect to what you do, when you do it, and how you do it, and all based on predicated upon the information available at hand at the time. We have a requirement to take your best information you have, and based on that information, take decisions and actions that are reflective of your understanding at that particular point in time, given who has the ability to certainly bring resources to bear. Unfortunately for me, I don't know what was going on February 12th, other than what I certainly recall from the news media as well. So I can't address and say what should have been done or not done at that point in time because I'm not aware of the information. I will tell you this. As a commander, as a commander, there were times when I made a decision very, very quickly that I said, wow, I should have maybe waited 3 or 4 days because I had some information that I didn't have at the time. And there were times when information that I didn't have, but I just felt I needed to make a decision. I made that as well. And it turned out to be a good decision at the time. But there have been other times also that the decision was made and said, it would have been a better decision had I waited. So it's not the type of scenario that you can say absolutely what should have been the case or not having this thing called facts bearing on the situation, and you need to take advantage of those to the very best you can. And that's what we tried to do. And I would imagine and guess that that's what the leaders have tried to do. I'm not sure. I don't know. I wasn't there, not privy to that. But I'm certain that from the standpoint of the military point of view and perspective, you have military, especially here in the Homeland Defense arena, the Northern Command, that they were doing those sorts of things based on information at the time and preparing themselves, looking at the contingencies, determining what might be available, should be called upon, and then preparing to offer that up as soon as it was requested by the National Command Authority or by the states.
All right. Retired General Kit Ward, we surely appreciate you joining us, giving us that analysis. I keep saying this. It's important for us that we see African Americans who are doctors, who are experts in pandemics, but also in the military out here, because unfortunately in mainstream media, you swear when it comes to black generals, only one exists is Colin Powell. So always glad to have your voice, and we appreciate you joining us.
Thank you.
One of the things that I also want to talk about today, of course, at the news conference today, is the constant just lying from the liar-in-chief. If y'all want to see how this man just makes shit up, listen to this exchange with Kristen Welker of NBC. Check this out.
Follow up, one on the economy and the other on the broader picture here, but just to follow up on my colleague, some people did note that your tone seemed more somber yesterday. You talked about that August timeline. Did you see a projection? Some people thought perhaps that 2 million potentially that could die maybe prompted part of that. Was there a shift in tone?
I didn't think, I have seen that where people actually liked it, but I didn't feel different. I've always known this is a pandemic. I felt it was a pandemic long before it was called a pandemic. All you had to do is look at other countries. I think now it's in almost 120 countries all over the world. No, I've always viewed it as very serious. There was no difference yesterday from days before. I feel the tone is similar, but some people said it wasn't.
That's one of the economy. Your former economic follow-up.
Okay, so we all know that's a straight-up ass lie. Here's a video some folks have put together that just exposes how bad of a lie that is. Go ahead and play it. The video in there.
We have it totally under control. It's one person coming in from China. We have very little problem in this country at this moment, 5. A lot of people think that goes away in April. With the heat, it's like around 12. Many of them are getting better. People die from the flu. It's going to disappear. One day, it's like a miracle. It will disappear. View this the same as the flu. And we only have 15 people, and they're getting better. Take a solid flu vaccine. You don't think that would have an impact or much of an impact on corona? No. Anybody that needs a test gets a test. They're there. They have the test.
We don't have enough tests today.
It'll go away. I am confident that by counting and continuing to take these tough measures, we will significantly reduce the threat to our citizens.
The number of confirmed cases continues to surge, now closing in on 3,500.
Yeah, no, I don't take responsibility at all.
Now, he never thought it was always a pandemic. That's a lie. He just lied.
Well, I'll say this to actually parse what he said. I actually do believe that the president felt like this was a serious thing all along. I don't think
based on what? Based on what?
Listen, I believe that the president felt that this was a pandemic. What the president decided to convey to the public is a totally different story.
Oh, Mellick, that's bullshit. Mellick, please, Mellick, no. I need you to show me, provide me some evidence, something where he actually, first of all, Mellick, hold on, stop. First of all, can you define pandemic?
Why would I need to define pandemic?
Because clearly your definition of pandemic and what he thought is totally different from everybody else's. You asked me what I thought. No, no. But also, I need some evidence. I need some evidence that he actually saw it as a pandemic. He literally said on January 22nd. Mellick, on January 22nd, and that was a leading video. He said, "Oh, this is from one person from China. It's contained, under control. That's not a pandemic."
You asked me what I thought, and I said what I think that the president actually had felt that it was a pandemic.
Based on what?
What I also
based on what?
Well, if you just bother for one quick second to let me finish what I'm saying, what I also believe that we have a president who is the kind who will try to downplay it or in many cases overplay something to make him or his administration look good. So I believe that there are definitely people around the president who were saying that this is something that we need to take seriously. I believe that the president did take it seriously. I also believe that the president just chose to portray a different picture as far as where the government was at that time.
Kelly, I got to bring you in because if you want the perfect example of a torturous word salad, that's what Mellick just said.
Just listen to Roland show on any day.
To actually suggest, Kelly, that Donald Trump thought this was a pandemic from the beginning, when his own words can be played back where he completely treated this as not a big deal, did not see it as that significant. And Kelly, go ahead, comment, please.
Well, to answer your question as to what a pandemic is, initially, the CDC defines it as an epidemic that has spread over several countries or continents, usually affecting a large number of people. That's what we have. That's why we're calling it a pandemic. 45, at the beginning of this pandemic, explicitly said that it was not a pandemic. He said that it was only contained to one person in China. Then he said you can get a flu shot and you'll be okay. And
actually said if you got coronavirus, go back to work.
Go back to work. So even if you've never heard explicitly him say this is not a pandemic, all of his messaging and all of his commentary thus far, up until really today, has been evidence of him saying this isn't that big of a deal. Obviously, that's not the case, because look at where we are right now as a country where literally all 50 states, including some U.S. territories, have at least one case of COVID-19 in their respective jurisdictions. So yes, it is a pandemic. It's a problem. I'm not surprised that 45 lied. He lies. That is what he does. Unfortunately, I don't take what he says to heart. I take it with a grain of salt. And it's unfortunate because that's supposed to be my commander-in-chief. We are supposed to trust him as citizens of this country to know what's going on, to be informed, to be cognizant, aware, and actually have our interests at heart. None of which is the case with this president. So I don't know what else to tell you other than the fact that, yes, he's a liar, and, get your information from elsewhere, like the CDC, World Health Organization, other places that actually have qualified.
Federal government. The federal government.
Michael, it is absolutely laughable to listen to this man stand there and lie the way he did by trying to say, I always thought it was a pandemic. I've always taken this seriously. We wasted a critical month because he did not take it seriously.
And I remember, early on, and I know you showed some of those videos, where he called it a hoax created by the media and the Democrats. He said that one time as well, which also wasted time, to your point, that it took away from about a month of getting prepared and getting tests. But I saw an interesting poll today, too, Roland, related to where his leadership is all about his base. I think it was like somewhere in the mid-70s of Republicans think this isn't that big of a deal because that's what he's portraying, rather than saying, hey, look, everyone, all Americans, including my supporters, this is serious. We need to take it seriously. I do think there is going to be shelter-in-place cities, states, probably nationally soon. I don't think there's, frankly, any way to avoid it with the numbers going up like they are. The question is whether he's going to lead or whether these governors. I don't know if you saw Governor Cuomo's press conference today. He was fabulous. He was a leader. He said, the buck stops with me. He laid out exactly what the roadmap was, what they were trying to do. And he said, look, there's only so much we can do. Federal government, we need you. We need you. Where are you?
Even Maryland's press conference today, and I'm not a Republican, but I have to give credit where credit's due. Governor Larry Hogan had a press conference today outlining, as much as he could, what the next steps were for the state, what was going to happen, what postponing.
Hell, he's taking it more seriously than Trump,
and he's a Republican.
We're
I'm sorry. Wait, Melik. Kelly finished. Then I'm gonna go to you.
Thank you, Roland. But even with Hogan is a Republican. He's on record not necessarily agreeing with Trump at every point in turn. I actually don't think that he likes Trump all that much at all. I haven't read or seen anything out of Hogan's behavior or messaging that says that he aligns with this presidency at all. But he's still a Republican, and he's more of a traditional Republican than what we see out here today, which is just aligning with 45, regardless of what comes out of his mouth. So I have to commend the Maryland's governor for, doing even what Cuomo did in New York, is in just taking initiative, doing the best he can, seeking help from federal government when necessary, but using what he has right now until federal government gets their act together and actually does its job.
Melik, go ahead.
So I disagree with the fact that the federal government isn't doing its job. I think it's unfair. What we like to have a lot of high-level conversations as far as the political appointees, but I can assure you that there are career staffers in the federal government who are working their asses off. And so to continuously hear from, much like we're doing now, about the bad job that the federal government is doing, as someone who's worked in federal government, I just wholly reject that.
Well, first of all, hold up. You can reject it all you want to, but Dr. Fauci has actually talked about the delays and how there were some mistakes. I'm not done. There are government individuals who are admitting that they have messed up.
It had nothing to do with what Donald Trump said or whether or not he denies that he thought that there was a big deal or not. The federal government has been hard at work since day one.
But if they don't have a leader actually telling them what to do, Malik?
We have experts who are around the president, experts who give press conferences every single day, letting us know how the federal government is choosing to respond to this. So to say that the federal government, and only give credit to Cuomo or Larry Hogan, when the federal government is literally doing this every single day, so much information that the federal government gives us, they let us know today that this whole scenario about the World Health Organization sending
No, Melik, they lied. Melik, they lied. They absolutely lied.
Well, hold
on. Stop right there. Stop right there. You just said, hold up. You just said, according to what they said at the press conference. I just played for you a straight up lie Donald Trump told at the very press conference.
I'm talking about the actual test kits.
And hold up. And Melik, that was also a lie. Melik, you're wrong. That was a lie.
I'm really not.
The problem.
So I'm not wrong. I'm relaying what the expert said today about the WHO.
This is the problem right here. Okay, You will knowingly accept a lie. You will knowingly
listen to
Malik,
yourself
you will knowingly
because
accept
you
a
know
lie.
that I'm right.
No,
in what
you're
I
wrong.
Wrong.
Michael, here's what's amazing. Michael, here's what's amazing. Michael, here's what's amazing. What's amazing is Malik, I'm talking right now. Michael, here's what's amazing. Here's what's amazing, Michael. Malik, I'm talking right now. Malik, I am talking right now. Guys, cut his mic.
You're talking now because I'm making a good point.
Cut his mic.
So of course you're talking.
No, I'm going to cut your mic. I'm cutting your mic. Here's why. And I've never done cutting the mic, but you don't want to listen. Here's actually what happened today. They were asked at the news conference about the WHO test. They talked about how the various tests had to pass a certain protocol. Here was the problem. It wasn't the WHO test that was failing. It was the CDC test that was failing. Michael, that is an undeniable fact. They tried to dance around this at the news conference, but that's a fact. The WHO provided 1.4 million of those tests across the world. The CDC test is what the problem was. Michael, go ahead.
And it all started whenever, I guess we can certainly debate when the first date was when we knew it was coming here. And the WHO, their first thing they are to do is to call the pandemic office at the National Security Council. But guess what? 45 got rid of that office in the National Security Council. So the WHO from the beginning had really nowhere or no one to coordinate with in our government. So our government got off to the wrong foot from the beginning because we didn't have those folks in place because he had to make cuts because of the tax cut, or he didn't think it was important. Either way, it was bad decision making. He clearly, and his government is not competent, doesn't know how to handle it. And I'm glad governors are saying, you know what? We need to move forward with how we need to move forward, and we'll just see what happens. If the federal government comes in, great. If they don't, we'll do our own thing.
Malik, this is exactly what was reported. This is exactly what was reported by a number of outlets that talked about the CDC testing. The New York Times, the Washington Post, the New Yorker, all of them. This is in the New Yorker. This is in the New Yorker. On February 5th, go to my iPad, 16 days after a Seattle resident who had visited relatives in Wuhan, China, was diagnosed as having the first confirmed case of COVID-19 in the United States. The Centers for Disease Control in Atlanta began sending diagnostic tests to a network of about 100 state, city, and county public health laboratories. Up to that point, all testing for COVID-19 in the U.S. had been done at the CDC. Of some 500 suspected cases tested at the centers, 12 had confirmed positive. The new test kits would allow about 50,000 patients to be tested, and they would also make testing much faster, as patient specimens would no longer have to be sent to Atlanta to be evaluated. The kits were shipped in small white cardboard boxes. Inside each box were vials. Inside each box were vials packed in stiff gray foam, which held the necessary materials. It went through this whole deal here. It said that the first batch of kits sent to more than 50 state and local public health labs arrived on February 7th. Of the labs that received tests, around 6 to 8 were able to verify that they worked as intended. But a larger number, about 36 of them, received inconclusive results from one of the reagents. And then it said, in a briefing a few days later, Nancy Messonnier, the director of the National Center for Immunization and Respiratory Diseases, said that although we hoped that everything would go smoothly as we rushed through this, the verification problems were part of the normal procedures. It was a whole deal. The CDC test, they failed. In fact, it says, still, the 3-week delay caused by the CDC's failure to get working test kits into the hands of the public health labs came at a crucial time. That's where the failure was. Not, Melik, in the WHO testing kits. It was in the ones that were developed by the CDC. That's what happened.
Well, I actually responded to the question that the reporter asked about the WHO test, and which is why I responded that what our federal government said, that those tests did not.
I didn't even ask you about the WHO. So you say you responded to what the reporter. You said I'm responding. You said I'm responding to what the reporter said. How are you responding to what the reporter said when you weren't even there? You're trying to say.
I literally listened to the press.
So did I.
It was asked.
So
in
did
the
I.
press conference.
So did I.
I'm telling you the question that was asked in the press conference, and that's why I made the reference to what people are saying about the United States rejecting the WHO test. So I was actually explaining to you the government's rationale for that. And I do want to add something else. Tim Morrison, who's actually the director of the Epidemic Response Unit that Michael actually referenced, well, what we found out yesterday in the op-ed that has been unrefuted at this point, in the op-ed that he had actually written on yesterday, what he actually said is that what happened is that based on information from not just Robert Gates, but congressional testimony and members of the Obama administration had said that the NSC had quadrupled in size since the Clinton administration. And so there should be a streamlining. What happened is that when Donald Trump came in office, they consolidated 3 directorates into one. And the one directorate that they have now is the pandemic response, and I think it's called the proliferation or something like that. But that is literally why that particular unit was disbanded.
Melik, you're dancing. You're dancing all over the place. No.
That's just information for your audience to know.
You're dancing.
Why
okay, but also that's a lie. The reason that's also BS because Senator Sherrod Brown sent Donald Trump a letter in 2018 about the disbanding of this office. Excuse me. I'm not done. What you have here is you have an administration that wants to move the goalposts and shift. Okay. Here's the reality. We wasted more than a month.
No acknowledgement.
We wasted more than I am talking. We wasted more than a month because the United States decided we want to develop our own test. Had we accepted the WHO testing kit,
that was not approved by the FDA.
We would be much further along, and the testing kits that the CDC had constantly failed.
That the government
they constantly failed. No, actually, what I'm saying is you probably wanted to get the WHO test and actually test it, but the CDC test is what consistently failed. Workers ages 18 to 64, or 44% of all workers, earn low-income salaries. They are our working poor. Applications for unemployment compensation has reached its highest level since September 2017. In fact, folks at Goldman Sachs estimates it's more than 2 million. The Trump administration wants to, check this out, they want to keep this thing down. They want to wait for those numbers to be released after they release the employment figures the 1st of April. Yeah, we know how that goes. Now, with so many people barely making enough to survive, how do they protect the money they have during this financial crisis? Well, joining us is America's Wealth Coach, Deborah Owens. Deborah, we have been seeing the stock market first of all, it's dropped down to the levels when President Barack Obama left the White House. And so all those gains during the Trump administration have been wiped out. I tell people, don't even bother opening up your 401k and seeing that number, because what it was on December 31st, and you look up and all of a sudden it's down 50, 60, 70, 80, $100,000. Just don't even open it and don't freak out.
Well, what I would say is this, Roland, and thanks for having me on again. You know, I love having these conversations with you, specifically around what our community needs to be thinking about in this current environment. Now, what I would say is not to not look, but I really want to prepare our community for what we're about to go through. Now, I have the great benefit is how I look at it, is having a perspective of what the stock market crash of 1987 was like. I had just started my career at that point, and I had a very similar, I have this similar feeling, but that was a financial crisis. And what we're seeing now is a health crisis that is causing a financial crisis. The other thing that is a little different is, in 1987, the number of people who had 401ks or defined contribution plans was a lot less. And so now pretty much average people have a considerable amount of their investments in with stock market risk exposure. So what I want folks to do is to don't panic, but be prepared. And so what I mean by that is we are already seeing a decline very similar to the same decline that happened in 1929. And that is the market as of today has declined about 35%, which is significant. And its significance, the real significance of it is how quickly it has happened. And so to that end, what I do want to say to your viewers, to our viewers, is this, is that even with a 50% stocks, 50% bonds or guaranteed account, you should, and we're seeing it now, you should anticipate that your investments, the value can decline by more than 30%. Now, in addition to that, if you have a sort of aggressive portfolio where you have, 70 to 80% of your investments in stocks, you could, based on historical performance, anticipate seeing that your portfolio decline by more than 60%. So the key to this is really recognizing what is the worst case scenario. And that's the conversation that I've been having in the Wealthy Youth Facebook community around, yes, for people who are younger, they will have time to ride this out. And just like in 2008, recover. However, for many in our community who are now depending on their 401ks because they don't have a pension, and let's say they're 5 to 10 years away from retirement, then it makes sense to reduce your exposure in stocks. Now, why do I say that? I say this because there still is so much uncertainty. I have listened to every one of your guests on this show this evening, and I think you would agree that coming out of each of, or if we just look at your last guest, the uncertainty that this virus, coronavirus, has created is the one thing that financial markets don't like, and that is not knowing when this is going to be over.
Well, and again, that is always the case, and what we have to also now deal with in terms of Congress is now dealing with this, with this package they're trying to put together. Different from your perspective, what should this financial package that Congress is looking to pass? What should it look like? What should it include? We're hearing that if you are an income-earning person from $75,000 to $99,000, you actually are able to get money. But if you're actually poor, you're actually getting less, something like $600 as opposed to $1,200, which is sort of idiotic.
It is idiotic, but it's exactly how this system is set up. And it's set up so that the people with the least get the least, right? I mean, that's basically how they structured these payouts. But So I would say certainly we can call our government representative, but you know me, Roland. I'm the old do it yourself, save yourself. So here's a couple of things I want to tell people. And in this environment, this economic environment that we're in. First of all, look at your essentials. Okay, so the basic things that all of us need are clothing, and most of us have far too much of that, shelter and food. So in this environment, focus on the essentials and make sure that you begin to look at your expenses from that lens. So what I mean is that if you know that, we just heard companies like Marriott, people are on furloughs. If you get any inkling that your income could be reduced, then you need to make sure that you're already paring down. And that's one of the other tips on here, is to begin to look at your expenses right now, pull out your bank account or your recurring subscription, anything that is a want and not a need. The time to cut is now, not after the fact. The other thing that I want, and I mentioned it a little earlier, is really take a look at your investments and how much stock exposure you have. I don't think many people, certainly, I hear all these, new financial bloggers, all these people kind of spouting off, it's time to invest in that sort of thing. Not for everybody. Okay, so if you are young, you have the advantage of time to recover. I don't think many people have experienced the kind of long-term economic recovery that we could find ourselves in. I don't have a crystal ball, but I have the benefit of age. And because of that, I know recessions, I know bubbles, I know stock market crashes, and we have to prepare ourselves for this being, because of all the uncertainty, for it taking some time to have some economic recovery. So that's the look at how much you're exposed to stock. And you need to, if you cannot afford to, if you don't have 5 to 10 years to recover, then you've got to reduce your exposure. Are there some opportunities in this market? Certainly there is, because if you look at the stocks that have done well and that are still doing well, they are what are now being called stay-at-home stocks, right? So they're your Zooms of the world, where you're able to do teleconferencing. They are, you see there's great demand for grocery stores. So the grocery stores are doing phenomenally well, provided that the supply chain and all of that holds up. So there are some bright spots. I just want to make sure that realistically that our folks are prepared to hunker down and at the same time be creative. Now, Roland, I do not espouse fear, but I am a realist, right? And so I think we all need to be thinking about, in this new environment that we find ourselves in, where many of us are working at home. Now, I am a small business owner, so most of my work is either done on site with clients or from my home office anyway. So I'm sort of ahead of the game. But one of the things that I've had to do, even with my business, is now companies are asking me to do webinars virtually because many of their employees are feeling financially anxious. So now I'm simply that workshop that I would have delivered in person, I'm now doing online. So if that is true, then what are some of the companies that are going to change the way they do business that now perhaps I can be employed by? I want you to be online looking for opportunities right now. Who are the companies that are hiring? We heard that Amazon is hiring more. I forget so go online, 7-Eleven, do your research now.
Yeah, 7-Eleven announced they're going to be hiring 20,000 people because of increased demand at their convenience stores.
Yes. So what I'm saying is let's not be reactive. Let's be proactive, and let's start looking. I think it was Wayne Gretzky that said, he looks at where the puck is going to go, not where it is. And I think that if we're going to survive and be resilient and weather this economic storm, we have to be creative.
All right. Deborah Owens, we certainly appreciate it. If folks want more information, where do they go?
Yeah, I tell folks if they want to learn about more tips, they can find us on Facebook, the Wealthy You Community. All they have to do is go in, search for the Wealthy You Community, and we are having these conversations every day.
And, of course, folks, we certainly want to thank the folks that asked me for being the sponsor of our American Worker segment and supporting Roland Martin Unfiltered. Deborah, thanks a lot.
Thanks so much, Roland.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, it gives you that flower effect like that. But if I wanted to also, because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, that goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's YouTube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. Is the Bureau President in Brooklyn, Eric Adams. He joins us via Skype. Glad to have you here, President Adams, on Roland Martin Unfiltered.
Thank you, Roland. Good to speak with you as well.
You're also running for mayor of New York City as well, so we want to go ahead and make that point. Let's talk about this here, this whole issue of what's happening in places like New York City. The reality is we've heard Mayor de Blasio say shelter in place, prepare for the worst. Today, Governor Andrew Cuomo, yesterday he said companies at no more than 50% in terms of employees. Now it's been raised 75% where the folks, non-essential folks, can't be in the office. Do you? And I made this point a couple of days ago. I think that we're doing this thing piecemeal. You had Bill Ackman, who went on CNBC yesterday and said, "Look, you got to shut this thing down for 30 days." At what point do leaders step up and say, you cannot do mass testing unless you actually shut it all down to get a true handle on what's happening in this country. Agree or disagree?
Agree 100%. And in addition to that, we need to do a real analysis of how we are approaching this crisis. To the heads of my hospital in Brooklyn, for those who are not familiar, Brooklyn is one of the 5 counties in New York. It's the largest. If it was a separate city, it would be the 3rd largest city in America with 2.6 million people. 47% of them speak a language other than English at home. When I spoke to the heads of my doctors, presidents of my hospital, they told me all the testing you had to go through the Department of Health, the State Department of Health. For every request they requested to have a test, 9 of the people were denied, 1 were allowed to get the test. That's extremely significant because you're seeing particularly in Brooklyn, there's an undercount because 9 out of 10 people were denied the test. I believe if you do analysis across America to those communities of color, you're going to see that there's an under-testing problem. So we really don't know how much this virus is impacting those communities of color. If it's happening in New York, I assure you it's happening across the country. And I think it's imperative that we have a real conversation about how do we shelter in place to really deal with this issue.
And again, the last thing in the world I want to see is a national shutdown where everyone is sheltered in place. But you look at finally where you have the governor of Florida who's been shameful because they were sitting here scared of losing spring break money. You had thousands of people congregating on beaches. Initially, you had states who were moving to say no more than gatherings of 1,000 people. Then some said 500. Then some said 250. And the CDC said 50. The next day, the CDC said 10. And the reality is there's no way to get a handle on who's infected and who isn't unless you do massive testing. Look, today, and here's what's unbelievable. You talk about 9 out of 10, Sean Payton, head coach of the New Orleans Saints, has announced he tested positive for coronavirus. You have, of course, Kevin Durant there in Brooklyn with the Brooklyn Nets and 3 other players as well. And I'm not singling them out, but you have to ask the question, how in the world are 8 NBA teams getting fully tested and NFL people are getting tested, but regular ordinary people can't get tested? There's a problem. And then Trump goes, well, hey, you know what? That's the way life goes, essentially saying, hey, the rich actually get these things. This is maddening. I read this New York Times story where this matriarch of a family, her and 2 of her kids have died. 20 family members are quarantined and trying to figure out what's going on. And then if you can have it and show no symptoms. So how in the hell you know somebody else has it? I mean, it's just sort of maddening watching this every day and this piecemeal hoping that this thing just sort of just, to Trump using his own words, goes away.
And so true. And you touched on 2 things that I want to touch on temporarily. One is that we stated in the state that the only time you get to test if you are really hospitalized and you are showing advanced signs of coronavirus, yet you're watching those without any signs at all receive testing. So we're sending a mixed message to the American public.
Advanced signs means you're damn near dying.
Without a doubt. And then when you look at the methods of testing, how are we allowing everyday people to receive the test? And that is what we're fighting for now. But also, are we using technology effectively? I'm speaking to you via Skype. Why are we using telemedicine? Telemedicine is a powerful tool to screen out those individuals who have questions that they want to ask. We just opened a telemedicine command center at my Brooklyn hospital, and it allows people not to overclog emergency rooms. And this is something we need to infuse into the healthcare crisis. But the real question Americans need to be asking is, we said a year ago, no, this has been predicted for the last 10 years or even more. We know we have superbugs. We know we're going to get a virus. Where's the playbook? How come we're not ready and we're caught flat-footed on these issues that we should have been prepared for, not only on the national level, but the state and the city levels? We knew this was happening. We should not be trying to figure this out right now.
Well, first of all, the Obama folks, before Trump was sworn in, they went through an actual exercise that dealt with this, and pretty much the Trump Trump people just blew it off and didn't take it seriously, and then wiped out many of the people who were actually supposed to be doing it. You talk about with the Brooklyn Hospital Center in Fort Greene with this outdoor tent facility to pre-screen people for coronavirus. That makes sense because, unfortunately, we're seeing in Parkland Hospital in Dallas shutting down visitors. I saw a tweet from Mark Lamont Hill. His dad has been ill, 92 years old, has been going there helping, feeding him. He's now moving to a nursing home. He can't go see his dad, and he literally said to me, he said, I may not see my dad ever again if he doesn't get well. Eric Deggans, who's a media reporter for NPR, same thing. The hospital where his mom is ill had him ordered all folks to leave. He detailed how he was caring for her and was staying on the nurses when it came to changing her IV bag, her saline solution bag, things along those lines. And so you got people who are saying, they got ill parents who are saying, because I can't even visit them now, I may not never see them again. And so with this tent that y'all have set up, so essentially explain to folks what it does. So is it pretty much that you still have the hospital that's operating, and then the people are not entering the actual hospital, they're going in this tent?
It's so important because here's the problem that we're facing across the entire country. We're running out of emergency room beds, and we're running out of beds. And so what we set up here in Brooklyn is two things. Number one, we set up a command center for the telemedicine. This way we can stop people from coming to the hospital. Then we set up this tent here that's connected to our emergency room. We have a team of doctors and physicians and nurses who would actually pre-screen the patients to determine if they need to go inside the emergency room and be treated for coronavirus or any other illnesses. Because just because coronavirus has appeared, it doesn't mean other chronic diseases have disappeared. And so by filtering out those and using a triage method, we're allowed to treat those who are in real need and those who won't clog up the healthcare center. It's a great program. I was there this morning and watching the hundreds of people online. I saw the telemedicine center as well. All of our hospitals in our country must start looking towards telemedicine and looking towards how do we pre-screen people.
This is obviously a continuing problem, and unfortunately, we are not seeing the kind of results. I do have to ask you this here. I saw one story. I saw several stories. How are you dealing with your employees? I saw a story say that like 60 or 65 out of your employees have to come in, and you made a point that you said it was unfair to hourly workers compared to higher paid salaried workers. Explain that.
And that's a great question. First, none of my employees that wanted to stay home, I refused to allow them to stay home. 5 employees came to me. They said they wanted to stay home. I said, you have a right to do so. We're not going to do that. I'm so proud of my employees because they stated we want to be in the office. We have all of these people who are in crisis. We want to deal with them. What the city put out, they stated that all non-essential employees, those are managers, they told them they could stay home with their families, and all the other employees, they have to come in. I said, that is not right. My managers are paid more. If you pay more, you do more. I'm not going to sit home my managers who are paid at the highest end and tell my everyday hourly employees, you have to come in. And that is what, when you hear the term of telecommuting is something that is given to the high end of the employee and civil service pool. Over 350,000 New York City employees, 10% of them can telecommute, non-essential. That's the high end of the spectrum. That is not my bus operators who are predominantly black. That's not my 9/11 operators who are predominantly black and women. That's not my nursing staff. So I say no to saying the high end can go home and the everyday people who are making the city run, we're treating them differently. That's unacceptable to me. And I told my managers that you will stay with the team and we will all get through this together.
All right. Brooklyn Bureau President Eric Adams, we appreciate you joining us on Roland Martin Unfiltered. Thanks a lot.
Thank you.
You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. What's joining us right now is someone, again, who knows very well when it comes to the military, how things are handled, how do you deal with issues like this, trying to mobilize and get people organized. That is retired General Lloyd Austin. He, of course, was the 12th commander of the United States Central Command, the first black commander, the head of the organization, and also served as the commanding general, the last commanding general of the United States Forces Iraq Operation New Dawn. And so, General, we're certainly glad to have you here on Roland Martin Unfiltered.
Glad to be here, Roland.
All right, so as someone who has commanded troops, when you look at this this coronavirus epidemic, we're seeing it going on all across the country. You have states who are saying shelter in place. The federal government has not given that order yet. They're trying to get a handle on it. Tests are increasing constantly. As someone who has commanded troops, do you believe that we're at a point where what these governors are doing, Fauci has been saying, we actually need to do this? We got to shut the country down in order to get a handle on making sure people are getting tested, folks not congregating, and to understand how widespread this thing is.
Clearly, it's widespread. What's dangerous about it, a lot of things are dangerous about it, but what's alarming is that it's moving with incredible speed, and it can be transmitted very, very easily. And so the magnitude of this problem, Roland, is unlike anything that we've ever encountered before. You know, typically when you have a national emergency, something like a hurricane or a tornado or an earthquake, it's centered in one part of the United States or one part of the world. And you can mobilize resources from other places and direct them to that place in need. In this case, when things hit the fan, the globe got sprayed. And so it's very difficult. It's impossible to shift resources around. What you have to do is bring things up to scale as quickly as you possibly can. And what the military does is it adds scale can add scale to the problem. It clearly can provide command and control and structure. It has capability in the form of labs and some other things, and it has some of America's best people. The military has been employed or utilized in a number of national emergencies, but we are typically not the lead federal agency when it comes to something like this. Typically FEMA is, and that's the case in this case. FEMA has a lot of capacity. And the military is in support of FEMA and providing a number of types of capability. And you just heard one governor talk about how he's utilizing his National Guard forces. So again, this is different from anything that we've ever seen. And I want to remind you that the focus of the military is to protect the United States of America. And so, and by the way, we still have troops deployed in Afghanistan and Iraq and other parts of the world. The medical capabilities of the military are focused on supporting those troops that are deployed and helping the military to gain and maintain the required readiness in order to be able to protect the country. So the military adds significant value can add significant value to an issue like this. By the way, I doubt that you'll see, and anything can happen, but I doubt that you'll see in the near term that the president will issue an order for the entire country in terms of, stay put or something of that nature.
Why is that?
I think that's probably best left to the local governance, the governors, the mayors, to work through that. The national government, I think, is focused on providing resources and direction and those types of things.
But what you have, though, is you have yesterday, Trump stood there and said, look, federal government, we're not shipping clerks. And you have others who are saying, no, the federal government can use its power. And for instance, with this one CEO who said a company is trying to charge $7 per mask when it normally costs 58 cents. Mm-hmm. The power of the federal government is to be able to say, come in, take a seat, do this, and this is what's going to happen to you. I mean, that's where, but that's also where leadership comes in. As you've watched this, and we played a video yesterday, folks, get that video ready. It talked about just these contrasting comments where it's no big deal, it's just one person, this is under control, it's contained. You had Larry Kudlow early in February was saying, oh, no, this thing is, we pretty much got this thing airtight, contained, buy stocks. They were saying all these different things when it wasn't happening. And so at some point, leadership has to be honest about exactly what's going on so people are hearing the truth and you're not getting these conflicting messages.
Yeah, and I do think that as time has evolved and our scientists and our doctors have had a chance to take a look at how this thing has progressed on the international stage, it's provided an ability to model a bit more and better. And so now I think the true threat is clearly recognized not only by our government but by governments around the world. And so recognizing, the potential of kind of the breadth of the spread of this and the speed at which it's moving, this requires a national effort, not just a whole of government effort, but a national effort. And what I mean by that is that all of the agencies in the government have to work together under the direction of the White House. But we also need industry, Roland, to stand up and really lean into this. And I think you're beginning to see that. I think you'll find that in this country, as you well know, Roland, there's people will exercise initiative to get the right things done. We saw that from the very beginning. CDC says, hey, this is dangerous, and you need to be concerned about large gatherings. So based upon that, the NBA shuts down. Then the NCAA shuts down. Then a number of other things shut down. Individual initiative versus a mandate from on high. So I think what you're seeing, what you'll see is companies across the United States of America begin to lean into this in a major way. But it takes a little time to gear up to produce masks if you haven't been accustomed to doing that.
Which means that every day matters. I mean, every day, every moment. I want to play this. And there was a group. Look, they're not lovers of the president. They put this video together, but I think the timeline is important when you hear what was being said January 22nd, and then what you begin to hear in February and March. Go ahead and play it.
We have it totally under control. It's one person coming in from China. We think we have it very well under control. We pretty much shut it down coming in from China. In April, supposedly it dies with the hotter weather. When it gets warm, historically, that has been able to kill the virus. People are getting better. They're all getting better. And the 15 within a couple of days is going to be down to close to zero. It's going to disappear. One day, it's like a miracle. It will disappear. And you'll be fine. They're going to have vaccines, I think, relatively soon. Not only the vaccines, but the therapies. Therapies is sort of another word for cure. We're talking about very small numbers in the United States. Our numbers are lower than just about anybody. It's really working out. And a lot of good things are going to happen. And we are responding with great speed and professionalism. It's going to go away. Yeah, no, I don't take responsibility at all. We're going to all be great. We're going to be so good. This came up, it came up so suddenly. This is a pandemic. I felt it was a pandemic long before it was called a pandemic. All you had to do is look at other countries. The coronavirus, you know that, right? Coronavirus. And this is their new hoax. We're 15 people in this massive country. And because of the fact that we went early. We could have had a lot more than that. We're doing great. Our country is doing so great.
As somebody who's led massive amounts of people, does that frustrate you when the commander-in-chief makes those statements and it gives the impression early on, no big deal, everything is fine? When the scientists were going, no, it's not. In fact, when there's a military intelligence unit that began to track this, they were saying, this thing is real. Those comments, that's probably what drives me crazy, because that's what led to people going to beaches and keep having gatherings, because it's kind of like, oh, it's contained. He said it's fine.
There's no doubt, Roland. I've not heard anyone say, or very many people say, that we weren't late to need. We were late to need. Certainly I wasn't in the room when these when the input was being provided to senior leadership and the assessments were being made. But I think that when your experts are telling you something, then it pays to listen to them, and it pays to begin to focus on gathering up the resources to address the problem. And obviously, we didn't do that in a timely fashion. Now we're racing to catch up. And again, we understand more and more each day about this threat. And what we know now, Roland, is that it's going to require a lot of resources to get in front of this. We're behind it, and more time will pass before we can generate more or fabricate more equipment, personal protective equipment and masks and ventilators, because you got to retool some things. You got to really get industry to lean into this. But my sense is that industry has begun to lean into it, and shortly you'll begin to see some progress. And we hope that that'll be the case.
If the order came down for the military to mobilize and assist, not necessarily lead, but assist, what does that look like? What kicks in? How does it then go from that decision from the White House to the military, then to the rest of the country?
Yeah. So you're right. We wouldn't lead this. It would be led by a federal agency, and is led by a federal agency, FEMA. As the discussion evolves, we'll focus on, what problem is it that we're trying to solve that we can bring military capability to bear to help this problem. Again, we know that we have a need for personal protective equipment. The military has some of that in its stockage, and I think you've heard the Secretary of Defense say that he's willing to, not willing, but he will provide some of that. Mask, ventilators, and that sort of stuff. That's all helpful. We have labs that can assist with testing. So we would take, and I'm sure the military is taking a look at, where can we add value to this overall effort? But the military can do a piece of this. This will require, and I think it'll get, a lot more capability than just the military alone can bring to bear. We can help erect and fabricate shelters for additional beds. We can use some of the military personnel to displace some of the people that are on the front lines, swabbing noses and taking samples so that they can test people. So there are a lot of things that can be done and are being done, quite frankly, as you've seen. That there's a hospital ship that's soon to be headed to the East Coast, New York. There's another hospital ship headed to the West Coast, and that's pretty significant capability. Now, you wouldn't want to put COVID patients on a hospital ship because of the confined spaces. But you can use those beds to open up spaces for folks who have other problems, and you can displace some. That can create some space for COVID patients eventually.
But the military is also very familiar with going in, having to erect hospitals, having to be able to commandeer land to be able to create those tents. We had the Brooklyn Bureau president on yesterday. What they did was they erected these tents outside of the hospital to serve as an entry point. So instead of people coming into the hospital, the point you just made, they were going through this tent first to get assessed to determine what happens next. And the sense that I get is that from these local hospitals and these mayors and these governors, I mean, the reality is, as you said, from a national standpoint, they aren't used to having to mobilize entire states. Like you said, look, I've lived through 3 hurricanes in Houston, and so what happens in this city or this particular area of a city, this is a whole different deal. To me, that's where the capability of the military comes in, where y'all are used to going in where there's absolutely nothing, then all of a sudden, a city all of a sudden is erected.
You're right. We bring scale, we bring structure, we bring command and control, we bring speed. And again, we know how to get a lot of things done, and I think this capability should be used, and I think the governors are tapping into that capability. And just the Army alone, you have three components, as you well know: active Army, you have Army National Guard, you have U.S. Army Reserve. So that's three different components. Each of those components has some medical capability, units that have medical capability. So there's a fair amount of potential there. And again, it just need to focus. We just need to focus on what are the major problems. Where can the military add value, and then quickly make those decisions to employ those capabilities.
When we talked about speed, talked about time. I talked about how, again, it's every day you didn't have it taken seriously what was going on. I remember we played a video from Senator Kamala Harris, February 12th. That was a hearing, Department of Homeland Security. And she actually posted that video on that day. And there were Trump administration officials who didn't even come to the hearing. The purpose of the hearing was to discuss coronavirus. And the response was, well, we don't have our talking points together. Here were United States senators who was a hearing on February 12th who were saying, hey, what is happening here? And that seemed to be a huge problem in this whole idea of just, well, we're not really ready to talk about it. And now all of a sudden it's like, oh, no, we were always serious about it. But then when you look at the response, when you look at the fact that we still are not, despite all we're hearing, we don't have massive testing. You still have people who are showing symptoms, whose doctors are saying, I need them tested. They said, oh, they're not serious enough. And doctors are going, what in the world am I supposed to do? And to me, that delay of being able to have mass production of those tests, being able to go to those companies and say, what capability do you have? How can we retrofit your companies to now produce ventilators? Things along those lines. That to me was for me a dereliction of duty from this president in the White House. By not taking it seriously, has put us in the position that we're in now.
I think, again, we are late to need, but I think that you'll see, once all the segments of our society, of this country, are engaged, and I think we are at this point, I think you'll see things begin to pick up steam, and that flywheel begin to spin, and it'll come up to max RPM a lot faster than people would have thought possible. But again, you got to.
I understand, Ben. Look, you respect the chain of command, being the general, 4-star. When it comes to these news conferences, should the scientists be leading them?
I've always felt that having the folks who are the experts talk about the significant issues is the way to go. I think they're committed to providing factual information to the public, and that's really, really important in a way that the public can comprehend and digest. What we want to make sure is that people understand what it is they need to do to protect themselves and their families, and understand also that the system is beginning to work hard to deliver the capabilities that we'll need to counter this going forward.
Last question. Are there one or two things currently not being done that you believe should be done?
Well, I think you've heard a number of people say that we need to increase the amount of tests available so we can get a better picture of how big this problem really is. And again, since I am not in the decision-making loop and I don't fully know all the things that are being done, I don't care to second guess at this point. I suspect there are a number of things happening behind the scenes that we're not aware of. But I would tell people that if you want to know what the military is doing, if you go to DOD.gov and look at the latest updates, you'll see what the Department of Defense is doing. If you want to know what the Army is doing, you can go on the web and figure out, or gain information about the latest decisions that have been made to deploy resources or employ resources. So I think a lot more information is out there now, Roland, than was just 48 hours ago. So I encourage people to be proactive. Check out the websites to see what people are doing and what they're actually, the decisions that are actually being made.
Well, and we also have to be mindful of the fact that members of the military are also impacted by this as well, because we need to ensure that they're being tested and we know whether or not they have coronavirus and how their families are impacted. We're seeing that on with medical personnel because they can't go home. They can't actually see their family members. And so that's one of the things that we have to also remember as well, that they might be National Guard, they might be in Army, Navy, Air Force, Marines, Coast Guard, but they still are regular folks who are dealing with the same thing we're dealing with.
You're exactly right. And when you unplug a nurse out of the civilian community and mobilize that person to go be in a National Guard unit, you've just taken away a little bit of capability out of the community that you need there. So you have to really be careful about what decisions you're making and what kind of capability you're trying to take and apply to the problem set. What I would leave you with, Roland, is that, our military has never failed this country once in the country's existence, not once. When called upon, they will rise to the occasion, and they will put country and the people of this country before their own personal concerns. But the issue that you just raised, that the service members have family members too, is something that we need to continue to be mindful of. The military will always want to do our part or their part to help, and again, they have never once failed the United States of America. So.
General Lloyd Austin, retired 4-star general. We appreciate it. Thanks a lot.
Thanks for having me.
And so in the history of the Army, how many African Americans have been 4-star generals? Is it 7, 8?
I think we're up to 9 now.
Okay. All right. Well, our goal is to get.
I was number 6. Bro.
You were number 6.
Yes.
Wow. That's crazy. That's crazy. So, and also, when I interviewed General Brooks, one of the things he told me, he said that y'all always make sure that when one retires, there's always one who's coming online. So who's the current active duty 4-star general in Army?
General Mike Garrett. He's the commander of United States Army Forces Command down in Fayetteville, North Carolina, Fort Bragg, North Carolina. He's a great American, and one day you should have him on your show.
All right, we'll do that. Well, luckily, of the total number, I've actually talked to 5 of them. So I've talked to probably a majority of them. So we'll definitely try to get them on as well. All right, General, I appreciate it.
You should have us all on at one time here at some point, bro.
Right, and guess what? Y'all can probably all fit on one set. Absolutely, which is not a good thing. General, we appreciate it. Thanks a lot.
Thanks.
All right, folks, with so many mandatory shutdowns in states across the country, people who are following directions and staying at home are wondering how long this virus is going to be a danger to everyone. The key to that is understanding how viruses grow and mutate. Here to join us, here to talk about that is Dr. Joseph Graves, professor of biological sciences at North Carolina A&T University. So, Dr. Graves, so break this thing down, because now we're hearing, now people are scared to even touch packages. Now we're hearing that the coronavirus is airborne, that it could now reside on the corrugated boxes for 4 or 5 days and surfaces. So now people are just totally freaking out. And so walk us through exactly, what all of that means. Is that true or not true?
From what we know, viruses can persist on surfaces for a number of days. What I've seen in terms of the coronavirus is 72 hours, but that's always going to have a plus or minus to it. So the key with regard to touching surfaces is always going to be maintaining your own personal sanitation. That means if you receive a package in the mail, you should probably leave that packaging outside if you can, take out the contents that you need, and then you should thoroughly wash your hands. And that means getting a lot of soap on there, getting in between your fingers, getting your nails.
Okay, how about this? Okay, how about this, Doc? Okay, so I got a package today from Amazon. So you're saying I should open it up outside? But then, no, I can. But then shouldn't I also open the box as inside of the box and take the item out? And then, because again, if the item came from a company in China or from some other different company, I mean, and so then, but what about the item itself? Somebody had to assemble it. So what do I do? Do I then spray the item down with something and then wipe it down?
Again, if you can wipe down the item with an antiseptic, it's probably a good practice. The chances of, let's say, if this thing was assembled in China 6 months ago, the chances of a virus staying viable on the surface of that item is very low. But at the end of the day, your protection is always going to be assume the worst and use soap and water and keep your hands clean. In particular, after touching items, make sure they don't go near your nose or your eyes.
Got it. So again, I'm gonna go back. So if we get a package, so let's just say now, not just a package that came from Amazon, but let's say it's a package. We went to Costco or Sam's or even a grocery store. It's a box of cereal. Okay, you went to the grocery store, it's a box of cereal. So what you're saying is, if you went shopping and then you got that package and then you came home, what you should do is, if that box of cereal, get some wipes and wipe the outside of the box down, then go wash your hands.
I think the best thing to do would even be to transfer the cereal into your own container.
Okay, transfer the cereal in your own container and then throw out the box. Okay.
Out the box and then wash your hands.
Oh, so same thing. If somebody went out and bought a pack of cookies or whatever we bought that's in another container, then what we should do is transfer it. So if it's some meat, put it in Ziploc bags or whatever the heck, and then throw that package out. But absolutely, before we touch it, wash our hands, and then after we throw it out, wash our hands.
Yeah, and if you have the option to buy disposable surgical gloves, my laboratory, we work with bacteria all the time, and so my students are always in the lab wearing gloves. And so when we work with, bacterial samples, we have gloves on. They then dispose of the gloves, and then they wash their hands thoroughly, singing, happy birthday to me at least 2 or 3 times. And the key, again, is getting lots of lather, because the way you get the virus off of your hands is by the action of the soap. And people should not, by the way, have overdue confidence in antiseptic and antibacterial substances, because one, generally they don't work well against viruses, and even in the case of bacteria, they tend to lead to the bacteria evolving resistance to the antiseptic. So the tried and true manner to keep viruses and bacteria off of your hands is good old soap and water.
Gotcha. So all right, so let's talk about again. How do viruses grow and mutate? So
viruses are actually non-living genetic codes that are wrapped inside of a protein shell. They probably originated in the genomes of the organisms that they inhabit. And so they then become essentially rogue genetic codes that are copying themselves at the expense of the host organism. And since DNA, when it replicates, the protein machinery that replicates the DNA or RNA, in the case of the coronavirus, is incapable of doing that without making a mistake. Those mistakes we call mutations, and that's what drives the evolution of viruses. The viruses that have the ability to replicate most successfully inside of the cells of their host are the ones that persist and go on to infect more hosts. And that's simply the way all genetic systems work: replication, mutation, natural selection. And that's what's happening with the coronavirus.
Mustafa, got a question?
Doc, there are some rumors going around right now on the internet about folks being able to utilize garlic, colloidal silver, a number of other things. Do you have any sort of tips for folks if any of that is effective, or should we stay rooted in the science that we currently know that people should be doing?
Yeah, soap.
Yeah, well, My laboratory was the first laboratory in the world to show how quickly bacteria can evolve resistance to silver. And so if bacteria can do it, viruses can do it too. So certainly, if you have, and there are a lot of products now that use silver in soaps and in bandages, etc. They're going to work for a limited period of time before the viruses evolve resistance to them. So at the end of the day, this is what we call a co-evolutionary race. Every substance that we devise to try to control the virus is then going to lead to the virus's evolution of resistance to that substance. And then we devise a new substance and they evolve resistance again. And so this is something that we will never be able to get out of. Viruses are going to exist as long as animals and plants exist. They're going to co-evolve with them. Sometimes they're going to be extremely virulent, like new viruses generally are when they come into a new species. And hopefully, the good news is that in general, new viruses tend to evolve towards less virulence over time. But the problem is in that first wave that hits a species, like in the case of the great 1918 pandemic, which killed some 50 million people worldwide. Now, this current coronavirus has that capacity, so we should not in any way underestimate it. But neither, and this is really important, should we jump into sort of wives' tales and urban myths and folklore about how to deal with, viruses and bacteria. There is a science of this, and we particularly need to employ that science. And I hate to say this, but part of the reason we were unprepared for this is because the administration that currently resides in Washington didn't listen to scientists and has hampered the ability of scientists to do their job with regard to the danger that now the world is facing.
Doc?
Yeah, so Dr. Graves, they're expecting this disease to come on in waves. So after we do this sort of initial hunkering down until probably mid-April to late April in some estimations, what should we be doing going forward as this disease will continue to be around, but maybe not as worrisome as this initial first wave from, say, February to April?
Well, it's hard to make predictions about when the virus populations are going to drop off enough so that we can stop with the social distancing. But let's say at some point we're going to have to. And so it's either the virus kills us all off or we get to the point where we feel safe enough to be able to resume, sort of life as normal. But what I said earlier in the program is always going to be your best friend with regard to personal sanitation and being careful about what you touch, when you touch it, and it going near your eyes and nose. So even before this specific virus, that was always good practice. And the other thing that I want to make really clear to the viewers on the show is people in my field, I study microbial evolution, we've been warning the world about these coming pandemics for near 70 years. And this corona outbreak is just one of many that we're going to experience, particularly as the human population grows, as more people are packed into less space. We've created the conditions by which viruses and bacterial disease have basically a windfall opportunity to spread themselves. So this is something is not going away. So we need to change the way we live, and we need to do it soon.
So, Doc, when you say that, when you say change the way we live, break that down.
Well, I happened to hear some of the discussion before I came on the air. And one of the things that really wealthy people don't seem to understand, that one of the unanticipated side effects of income inequality is creating a reservoir of people, for example, homeless people and incarcerated people, who are always going to be the target of these viral and bacterial diseases because of the conditions that they have to live in. But those people also come in contact with surfaces where rich people are. So if they think they're going to be safe by, cloistering themselves in their own communities, while allowing the majority of people in this country to go homeless or underemployed or thrown in jail, then they've got things absolutely wrong. Because even in their best interest for us to have people with places to live, people with employment that is meaningful, it's important for us to end mass incarceration. Even if you were just going to not even talk about the social justice aspects of it, epidemiologically, it is a terrible idea.
Doc, one of the things I find to be very interesting, and granted, you're a scientist. Some might say this is a question of faith, but also could be science. And that is, when you look at where we are now, I saw there was a video in Venice, and because the ships have not been able to travel, the dolphins have returned to the area near where people walk. There was someone who posted a graphic that showed the air quality in Los Angeles as a result of people not being able to travel. I've been hearing all over the place. Folks have been talking about, wow, man, I went for a walk and the air is different not going for a walk. When you hear someone say that this was Earth's way of telling the world, you need to slow your ass down, how do you respond to that?
Number one, and if you don't mind, I'd like to share with the viewers that I'm a confirmed Episcopalian. So I don't find any contradiction between my work as a research scientist and my work in the faith community. I don't find any contradiction to that at all. Now, the earth to me is an inanimate thing. So the earth isn't telling us anything. However, our behavior is leading to the creation of a world that is drastically dangerous to the quality of human life. And so you don't need the earth to tell you that. All you need to do is open your eyes and take a look at what's been happening over the course of the 20th century. If you haven't seen the videos of Antarctica calving huge sheets of ice bigger than states in the Union, if you haven't seen documentary films like Chasing Ice, where you see glaciers receding over in time-lapse photography over 50 years, then you're simply unaware of the fact that we as human beings are destroying the planet that gives us sustenance. And if we, again, do not change our ways, biological processes are going to let us know in no uncertain terms that the way we are living is unsustainable. Now, I don't throw that on God because, from where I stand, God is good. But people, on the other hand, have that. That's me turning on the automatic light.
We got you. We know it's God. Well, yeah, Mustafa said God was sending you a signal. Oh, go ahead.
So it's just going on with that. This is the kind of thing that really, again, calls into question the social structures, the economic structures that we built. The way we're doing things really can't deal with this kind of pandemic. We don't have enough trained doctors. We don't have enough hospital beds. We don't have enough health equipment, ventilators. I read a report from a nurse in New York City this morning who claims that they're already making triage decisions about which patient gets a ventilator and which patient does not. So, and again, since I think the focus of our conversation is also on people of African descent in the United States and other underserved communities, these kinds of tribulations are going to be visited more so on people who have been historically underserved with regard to the health care infrastructure, which, by the way, isn't prepared to help the entire nation. But the effect of this kind of pandemic is going to be even more devastating on the poorest people in this nation.
I'm going to ask you this here, Doc. So when I was driving in to work, 72 degrees outside, not that many people who were on the roads as well, and I had my sunroof open, had the windows down. And I was actually streaming and playing some music in the car, sort of our hashtag Rolling with Roland jam session before I came on the air. And I had a woman who said, Roland, are you not scared about the coronavirus being in the air with the windows open and the top down? So, okay, you're here. What about that? We're hearing that it's airborne. So, okay, what does that mean? We now can't roll windows down, can't open sunroof, can't open the windows in our house, can't go for a walk. Just explain that.
Yeah, that's probably an incorrect view of the situation. When we mean airborne, it means that one of the ways that the virus is transmitted is by people coughing and sneezing. And the viral particles will go into the air. Now, how long they stay in the air, and the virus is about 150 nanometers in size and diameter. It's not really clear how long it will stay in the air, but this is still probably several feet. So unless someone happens to be in the car in the lane next to you with their windows open and your windows open and they turn in your direction and cough at you, it's unlikely that you're going to get coronavirus from a random breeze. So I think we don't need to panic in that way yet.
Praise the Lord. Praise the Lord. Any other questions for Doc?
I'm good. He said it all. He said a mouthful. Yeah.
Well, Dr. Graves, certainly glad to have you here. One of the reasons why I created this platform is because it drives me crazy when these sort of stories happen and you swear that there are no black scientists, there are no black doctors, there are no black biological science, microbiologists, virologists. And so for our audience, it's been great for us to see the expertise that exists with our community and to be able to answer these questions. And so we certainly will be calling upon you and some of your other colleagues. If you got any other folks you want to recommend to us to have on,
actually, I would like to say one thing in that regard.
Go ahead.
This is the first year in the history of this science where 2 students of African descent earned their PhD in microbial evolution in the same year. The first is my student, Dr. Sade Boyd. She defended on Monday of this week. And the second is Nkrumah Grant, who's in the Lenski lab at Michigan State University. So they're wrong. I mean, there aren't a lot of us yet, but we are beginning to make progress. And so there is a cadre of top African-American scientists in the biological sciences. And I'm happy to forward you a list of names.
Absolutely.
Of people that you can have on your show.
Well, absolutely, because this is obviously going to be the story every single day. And so we want to be sure to give those folks an opportunity to share their expertise and knowledge with our audience. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. I do want to do this here, of course. A lot of churches who have gone to this whole issue of live streaming their services because they can't meet and gather. There were some people, though, who still had services on Sunday, frankly, putting their congregations at risk. E. Dewey Smith, a pastor out of Atlanta, posted a video explaining why his church chose not to have service. And he was real frank and honest as to why some pastors did have service. I want y'all to watch this.
I don't want to get into no fights with pastors, but let me say this. Our mortgage here at our church is $100,000 a month. Our light bill here at our church is $40,000 a month. We have 50 employees. We got a counseling center. We have a human trafficking program that we sponsor. We're building a church in Africa. When we don't have church, that threatens our operation. We're like other. So for us, when we made a decision to close our church, public worship services, that was not a fear. That was because we had regard, and for me, I love my members, and they want to put them in a position where they be sick. The faith for me was not in having church. The faith for me was saying, you know what, we're gonna prioritize people's safety and trust that God's going to help the people to meet our needs financially. That was faith. Just because you had church does not mean you got faith. Some of you guys had church because you needed that offering. And you put people in jeopardy. Some of you did that. Now, I'm not speaking fair about it, but for us, we decided to not have worship because we didn't want to risk our acceptable demographic, those who are over 60, because all the scientists, all the medicine people are telling us, health, CDC, WHO, all the organizations are saying this thing is pandemic. So for us to have a global pandemic and risk our membership, we felt that we want to love our members enough to let them stay safe, to follow the doctor's recommendation, and then trust that God's going to meet the needs. And I'm just believing and trusting God that we put people first. So just because somebody had church, sometimes people use those scriptures, twist them because they need the offering.
Roland, I was an usher at Canaan Avenue Missionary Baptist Church as a young man, a teenager. And every time we passed the collection plate, it was the same verse, Malachi. Will a man rob God? Yet ye have robbed me. Wherein do you say ye have robbed me? In thy tithes and offerings. That brother right there gave a word. That's a word, brother. And you know what? Mitch McConnell, you clown. Donald Trump and all you rest of you people trying to figure out how to steal, as you heard Reese just say, with both hands trying to figure out a way to steal. That brother right there just showed you what the African in this criminal enterprise that you call the United States of America has kept from the time we came here, before we came here and got on the boats with it and brought here and have remained with it. Did you hear what he said? He said, I want to make sure my faith is in my people and that God will help us provide. And guess what? Those people will be the ones that come out their pocket and send that money in by any means necessary while you're trying to figure out how to steal with both hands. You better go read the Bible, Old and New Testaments, and go back to that Old Testament when you start dealing with Sodom and Gomorrah and figure out, as the Rastas know, what happens when Babylon fall. You don't have no faith in nothing but money. Forget in God we trust on your dollar bill. But let's be clear. What that brother just said, that is character. That's hard to replace, brother. That was very powerful.
All right, folks, back to that Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Nope. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear. So we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, you know, it gives you that flower effect like that. But if I wanted to also, unlike because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, it goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's youtube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. Roland Martin Unfiltered, youtube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's youtube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it.
Hey everybody, this is Sherry Shepherd. You're watching Roland Martin Unfiltered, and while he's doing Unfiltered, I'm practicing the wobble. Yes, I am. Because Roland Martin's the one, he will do it backwards, he will do it on the side. He messes everybody up when he gets into the wobble, because he doesn't know how to do it, so he does it backwards. And it messes me up every single time. So, I'm working on it. I got it. You got Roland Martin.
Hi, my name is LaToya Luckett, and you're watching Roland Martin Unfiltered.
What's going on, everybody? It's your boy Mac Wiles, and you are watching Roland Martin Unfiltered.
What's up, y'all? It's Ryan Destiny, and you're watching Roland Martin Unfiltered.
What up, Lana Well, and you are watching Roland Martin Unfiltered.
You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. Hey fam, want to check out Roland Martin Unfiltered, the blackest show on all of digital, cable, and broadcast. Check out our audio podcast. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. Press play.